everyone, I really hope you've enjoyed my videos so far, and this week's video is getting into what to do following total hip replacement surgery. Yes, for all of you out there who've just had your hip replaced, congratulations. Good for you. In my practice, I see patients quite often who've kind of missed the window of opportunity to get their hips replaced. And this leads to, the end of life being extremely painful and really debilitated with sometimes and a lot of times the inability to walk again. So good for you making the steps to a better quality of life. There are definitely some techniques and some exercises that will allow your recovery to go much smoother. That's what this week's video is all about. I hope you find it really helpful, and be sure to hit the subscribe button. Now, there are two most common ways of getting the hip replaced. Coming from the front, called an anterior approach, or coming from the back side, which is called a posterior approach. For those of you who receive the anterior approach, good news is there's not a lot that you really need to watch out for in terms of activity precautions, except for you can't get into a lunge position. It's too likely that it may dislocate and you need to go in for a revision. However, with the posterior approach, there are three things you should not be doing. Now, this should all be a review. Hopefully, this is all something that you're not hearing for the first time, because they should go through this with you significantly with a lot of review in the hospital before you get discharged. But number one, and the most important, to not bend past 90 degrees of what's called hip flexion. Now, when we sit straight up in a chair, we're at 90, and you can't go past that at all. That's the thing that I've seen most likely that will cause someone to have to go back to the hospital and have some kind of revision. Now, again, what I mean by that is when you take the torso and the femur or the thigh, see how this together forms a right angle, also sometimes called a 90-degree angle. Well, you are not supposed to go past that at all. This is, again, the most easily to be violated because as soon as we start to come forward, we're past that. So, and we want to be extra cautious to follow these precautions early on. You don't want to have to go back to the hospital and have to essentially do it all over again. So, not past 90 degrees of the hips is really, really important. Number two is to not cross the legs. Now, I'm not talking about just at the hips, but also at the ankles. So, for those of you who are leg crossers, this can be challenging. For those of you who are not really prone to crossing your legs, it's usually not that hard to adhere to. So again, that's not only at the hips, but also at the ankles. So no ankle crossing. The third and final is to not perform what's called internal rotation of the hip. Past 30 degrees is what I've heard in my practice. Past 30. So no significant turning in of the toe as we're walking. This normally occurs when someone is walking with a walker and tries to turn a big 180 and turns that hip way too far. So taking small steps as we're turning can really help to avoid the over internal rotation. So say I'm walking with a walker and I want to turn around. If I turned and put the walker here and then turn my foot and really tweak that hip, that's called internal rotation. And that would be past 30 degrees and might place you at risk. So instead of trying to do a big turn and then bringing that hip over, trying to take smaller steps as we go will keep that hip in a better alignment and you won't violate the internal rotation. So these are the three precautions to watch out for. I would check with your physician or surgeon if you haven't already to make sure how long they're going to last for. Usually it's 6 weeks, but sometimes that's surgeon dependent. But part of total hip recovery is to pay attention and follow strict adherence to these guidelines in order to prevent any kind of serious problem. Getting into the exercises for a total hip replacement, the first thing to understand is if you've just recently got home from the hospital, a deep vein thrombosis, or what is also known as a DVT or a blood clot, is definitely something to be concerned with. And the best way to reduce the chances of having a blood clot is to elevate the leg and combine that with ankle pumps to keep the fluid moving in that leg and not let it stagnate and kind of pool together, keeping the leg down in, say, a sitting position throughout the day. So if you want more information on that, refer to one of my previous videos, which will give you more information about how best to elevate and combine with ankle pumps and the techniques that I've learned over the years to help you with that. Following that, one of the best exercises for a total hip recovery is what's known as the heel slide. So we're just trying to lay back and slide the heel back. Now again, if you've had a posterior approach, you can only go to 90 degrees at the hip. And this is really important, so don't go past 90. So again, it's down and back, just to 90 degrees at the hips, which would be about here. You never want to go past that. So again, just to hammer that in, don't go past 90. And so up to about 90 and then back off. I don't recommend using a strap for this. It's just too easy to pull yourself past 90 degrees. Now, you're going to want to check with your surgeon about how long those precautions last, but normally it's 6 weeks. So just sliding back and forth. Now, endurance training is key with total hip recovery. So 10 to 20 repetitions is emphasized. Also 2 run-throughs of the exercises, and I would do that 2 to 3 times a day. Now, when they do a hip replacement, a lot of the times they need to cut through some muscles to get down into that area. And the muscle that they cut is actually a lot of times what's called the glute medius, or the muscle on the outside of your hip. Now, a lot of that depends on the technique that they use, but this is generally the case. So one of the most important exercises to recover is to do what's called hip abduction, or straight out to the side. Now, a lot of times with total hip recovery, this is something that is quite painful. So if it is, and it's the friction of your foot rubbing against the bed or whatever surface you're working from is too much, tie a plastic bag, like a shopping bag, around the foot, and it will glide much easier. And I highly recommend this in the beginning to make it a little bit less intense. So out and back. Being sure that you're close enough in whatever surface you're working from so that your leg's not going to come off the bed and aggravate your hip, but just out and back. So the next exercise for total hip replacement is what's referred to as a bridge. Now this is definitely getting into higher level exercise. So if this feels like too much, that's okay. Just wait on it a bit longer. And what I mean by if it feels like too much, if pain's more than a 5. Then also a straight leg raise. Now with the straight leg raise, we really, again, have to be careful about not past 90. So I would just come up to where your other leg is bent. Just right about the same level. And you'll know you're not going past 90. So this video has been all about what to do following total hip replacement surgery. But there are so many different topics I could post about. It all just depends on what you guys would like to see. So please post your comments below and subscribe so I can do my best to create a meaningful video for you or a loved one to improve quality of life. This is Dr. John Mayo, physical therapist, really hoping that this program is helpful for you or a loved one and improves your life. You